like everyone's still enjoying lunch, but I do want to say a big, big thank you to all of you that are here on time. I just feel like we need to be respectful of everyone's time, and I'm going to try to keep to the schedule as best as I can. So we are going to be starting with our first keynote speaker, and I would like to call to the stage Dr. Tanwir Hasan, MBBS, MPH, founder and CEO of AIHCON Incorporated. Our esteemed keynote speaker will be sharing his insights on the topic of revolutionizing primary care, the journey towards value-based, patient-centric healthcare. Please put your hands together for our keynote speaker.
Every life matters, and with that line, I want to start today's session. We're almost 10 minutes late. Supposed to be 30 minutes session, but I'll try to squeeze it in 20 minutes. But when I say every life matters, right now, every second, someone is experiencing their first child, someone is experiencing losing their parents or family. And how fortunate are we to be a part of the industry where actually we can touch life. And everyone, every human being, right now, almost 8.1 billion people, we actually have the chance to make their life better. And I think that to be a part of healthcare industry is actually very fortunate. At the same time, right now, looking at the global healthcare system, we feel like, are we really fortunate? That's the question we're asking. So today, I want to introduce DocPro, and we will be talking about primary healthcare, patient-centric care, value-based care model, and how revolutionizing primary healthcare can make a difference. So, at first, I'll just like to start with value-based care. So what is value-based care? Very simply, I think we all are expert in this field, but in a nutshell, if we want to say that adding value to the every step of value chain of healthcare, right? And when we are saying value, that actually is quality over cost, that how much we are actually spending and how much quality of life we are actually providing to the patient's life. So the first thing, I'd like to ask a question, that the first thing comes to your mind when you hear the term value-based care. So if anybody in the audience, we know that we have very few people here, but someone wants to volunteer, that what is the first thing comes to your mind when you heard about value-based care? Anyone, sir? Absolutely. And so the word value is actually very interesting. So we are thinking about the amount of money we are spending in healthcare and what is the quality. But if we think about the value, how can we actually define value? It's about the quality of life. It's about the patient experience. It's about the provider experience. It's about the pharmaceutical experience. It's about how the payers are feeling. So every sector of the value chain, we are adding value in value-based model. So it's not only about the doctors, it's not only about the physician, not only about the patients or the payers or the pharmaceuticals. It's actually everywhere we are adding value, and that is value-based care. So next, the difference, like why this value-based care model came. So before it was volume-based, right? So whenever someone sees a patient, we call it fee-for-service, or there are other payment model, capitation, ACP, and all those things. But what we think that value-based care means that you will be paid for the value you'll add to the patient's life. But there's a debate. A lot of people says that it's still like actually value-based care is the right model or not, right? But when we are looking at the past and see that, when volume-based payment model was there, what happened? there was overutilization. There was no control. Sometimes we were actually exploiting the resources. So value-based care wants to make sure that we are actually doing the proper utilization of resources, right? So next, when we come to the patient-centric care management. So patient-centric care management, so when you look back like 30, 40 years back, it was more doctor-centered. So it's all about like the providers, the healthcare providers, how they're behaving, how they're treating the patients. And at some time, because healthcare is an industry, if we look at any other industry, here the consumers are the patients, the service providers are the doctors or other healthcare facilities. So what we think that patient-centeredness is very important. If the whole system actually work, keeping the patients in the center, that will make a significant difference, right? So in terms of patient-centric care, what I would like to add that most of the time, because we were actually running a survey in New York, and we are seeing that how patient-centric care, like what do you mean by patient-centric care? We asked a lot of doctors, and we asked that, what do you think about it? So patient-centric care is a personalized healthcare, right? So as I mentioned, that every person is important, right? So when a doctor is seeing 70 patients per day or 30 patients per day, he keeps seeing all these patients, but that one patient is very important. Someone's father, someone's mother, someone's brother, someone's sister, someone's children. So what happens that it's very difficult for the doctor or the healthcare provider to think personally about that patient, right? So when we think about the population health burden, that hypertension, diabetes, cancer, obesity, depression, all other issues, it's not possible for a doctor to actually focus on one patient and give you holistic care. So that's where the value-based patient-centric model came. That you give like 30 patients care, and at the same time you provide a personalized health care. So next, this is the onion model. And very interestingly, right now I'm working with New York University, and this is the model I'm proposing, and our publication will come out very soon, that how actually we can change healthcare system. Because looking at the healthcare system, that if we dig deeper and see that actually what is the problem, and we are all talking about like digital health, we are talking about how we can improve the healthcare system, we are talking about patient engagement, but there is a way, like when we were doing research and we figure out that the most important thing actually is health-seeking behavior, that how you are seeking your health. Yesterday I was actually saying that, we always, like in terms of anything, we do the maintenance, right? But in terms of health, we don't care about maintenance. We don't think like it's important to maintain our life. We only see a healthcare provider when we are sick, and that is sickness-seeking behavior. So this sickness-seeking behavior needs to be converted to health-seeking behavior. And once we have that, so that means we are actually starting to connecting the dots. So the patients are doing their part, the providers are doing their part, and also the system is now connected. Because you cannot blame only the doctors or the healthcare providers to provide better healthcare. So also there is a part from the patient's end, that they also have to do something so that the doctors, like it's like they are coming halfway, and the patient's coming halfway and the doctor's coming halfway, and they are meeting at a point where the better healthcare can come, right? So if we think about it, that there's a quotation from Khalil Gibran that comes to my mind, that he said that every life is actually contributing to take the world to its art's furthest dream, right? So, and in healthcare systems, exactly like that everybody is playing and they're actually contributing to take the healthcare system at the next level. And here, when we look at the value chain, it's doctors, patients, payers, pharmaceuticals, hospitals, urgent cares, so many components. and everybody is actually contributing a little bit and take the healthcare system to a better system. So next, if you look at the global healthcare challenges, there are a lot of healthcare challenges, but right now I think the most critical part is lack of physicians, and second, the number of baby boomers actually reaching their age 65 plus, right? So in USA, every day there are 10,000 people are actually becoming Medicare eligible. So that's a huge population health burden. So if we look at it, that life expectancy is increasing. At the same time, there is a lack of providers. So now what to do? So I think that the way we actually can make a difference is proper utilization of resources. And that's where DocPro is coming. DocPro is helping the doctors to make their system more efficient. So make it more automated and to make it more proactive. So there's one thing, like first, if you look at the slide, there is 4.3 million healthcare professionals shortage, right? And then there is increased population health burden. And at the same time, there is lack of efficiency. And there's a huge cost. If you just look at the US healthcare budget, it's almost like $4.7 trillion now. Like you can run like almost 70, 80 France with that money, right? Even that amount of budget is not sufficient. Is it truth? Like why that's happening? Like this amount of budget is not sufficient to provide healthcare to that population because there is a huge lack of proper utilization of resources. And what we want, that we want to address those loopholes, and we want to help these healthcare providers to do the proper utilization of the resources. So right now, I already talked about this, that what is the urgency of patient-centered value-based care? Because at some point, there was patient-centeredness, and then it came like the value-based care. So altogether, so I think it's more important to have a merge now. So it's patient-centered value-based care. So we actually can do the proper utilization of resources, because if we look at the future, we can see that there will be almost like 100,000 lack of providers in USA. Not only in USA, globally also this is a big problem, that if there's no doctors, so now actually the doctors are replaced by nurse practitioners and other healthcare providers. So there is a significant problem. And at the same time, there is a huge population burden. So now what we need to do, that we need to have a proactive outcome-based care. So we can understand that even like some of the physicians in New York, we saw that they have like 5,000 diabetic patients, right? It's quite impossible for them to track every single patient's outcome and see that, how they can improve their health. So what we want, that you don't have to do all this. The system will automatically identify the problem, and the system will automatically solve, like give you a roadmap. So in every other business, if you look at it, they have a roadmap, any business. And for healthcare providers, that when we are in med school, we only learn about medicine. Nobody taught us about the business. Nobody talked about the financials. Nobody talked about like the health economics, right? So we don't know any of this. We learned about medicine, and then we come to a system, and now all of a sudden we are overwhelmed. We don't know what to do. And that's where like the physician burnout is coming, right? And physician burnout is a significant problem globally. And it's not for the medicine or the medicine practice. The main problem is the administrative burden, all the administrative complexity, the intricacy. And those things are actually creating more problem. So as I said, that every 4 in 5 healthcare workers, they're saying that they have been affected a shortage of medical professionals. Because it's not only like treating the patients, it's about like you have to fill out these forms, you have to do this, you have to do that. So they're feeling overwhelmed. And at the same time, now with the advent of technology, EMR is there, and you're not only seeing the patients, you have to complete the charts, and the doctors are like overwhelmed. And most of the doctors, they actually complete their charts over the weekend. So where is the work-life balance? Like I see the patient 7, 8 hours per day. At the end of the day, I'm completing the charts, and if the charts are pending, then I have to work during the weekend. So that's the problem DocPro identified, and they actually are trying to help the doctors to minimize the time of completing charts. So in a nutshell, what is the summary? Like what are the problems right now DocPro is addressing? Number one is 79% of the PCPs, they're complaining about burnout, right? Then almost 8 hours per day, that's the EHR or the EMR time drain. Then almost they're losing average like $600,000 per year because they don't have a proper data analytics with their system, right? And then 25% of their work is administrative work. And there is a huge shortage of the PCPs, like our primary care physicians are coming. And I already mentioned that 10,000 baby boomers are actually converting to Medicare every single day. So what DocPro is doing here? So DocPro is actually the tech enablers. We are the tech enablers. So whatever EMR you are using, whatever system you're using, doesn't matter. Irrespective of your tech stack, we actually come on board and we help to optimize your system. We help to give you the data analytics. We want to reduce the fragmented care. We want to give you, right now the systems are working in a reactive ad hoc model, like firefighters. Something, any urgency is coming, solving the problem. What we want to do that, we want to give them a proactive outcome-centric care. So they exactly know, they have a proper roadmap. They know that what to do for these patients, how to reduce the population health burden. Then the first thing what we are doing, so we have a tool that is AI-powered and data-driven. It's a very simple, we call it minute charting. It's like a karaoke. So what happens, like, like if it actually guides you, that you just mention one symptom, one problem, and it guides you that, okay, what are the things you need to ask from your patient? Suppose the patient is here for a pain. So right away, it will actually give you the roadmap, okay, what is the location, intensity, the quality of pain, what is the aggravating factor, associating factor, alleviating factor, whether there is any radiation or not. So everything is there. So it's like, like you don't have to think about it. Everything is coming automatically, and you are just reading it, and it's transcribing, and then it is actually pulling the data from your EMR, conglomerating through AI, and giving you the chart, and significantly, it's actually a personalized charting system we are providing to the doctors. And then the referrals. Referral is a big problem, because the primary care physicians, they're referring every single day. And there is a huge lack of completion of referral loops, because one of the example, one patient came multiple times with chest pain. The primary care physician referred the patient to cardiologist several times, and that patient was not compliant, and that's where the health-seeking behavior is coming. So they think it's okay, because they don't think like it's important. Until the chest pain is really severe, they're not feeling the urgency of going to the cardiologist. And that time, what happens that this patient eventually ending up in the ER. So now the cost of care is exponential. If the patient went to the cardiologist, see the doctor, do the stress echo, all those things, the cost might be $1,000. And now the patient ending in the ER, the total cost is almost $15,000. So that's where it's not anymore value-based. It's actually now, it's a waste of the budget, right? So that's why we are trying to streamline the referral system. It's connecting the specialist, the primary care physician, the patient. Everybody is in the loop. They have the guidance that exactly they know that, okay, this patient is actually waiting to see you. Because most of the time, the doctors are just giving the referral. The cardiologist doesn't have any clue that, okay, this patient is actually waiting to see him, right? So now we can come to the care gap plus. So gaps in care is a significant problem that, because there is age and sex specific screening. So we need to do the mammogram, we need to do the colonoscopy, we need to do the cervical cancer screening, all those things. But the problem is, when you have a patient panel of 2,000, 3,000 patients, you actually don't have any track. Maybe you are addressing 10%, 20%, or 30% of it. So now we are trying to activate the patients. That, like the patients will be activated, the doctors will be activated, and this is a system that will actually reduce the gaps in care significantly. And now looking at the healthcare wastage, right? So if you look at it, I just told, I was telling you that just sometime before that $4.8 trillion or $7 trillion, and the wastage is almost $1 trillion. Like, this is unbelievable. And now we are complaining that we don't have enough budget, but we are actually wasting almost $1 trillion. So that's where we want to actually come in, and we want to make sure that proper utilization of resources is very important at this time. And I think we already talked about this, how combating healthcare wastage is value-based model. And this is one thing I want to spend a minute, that quintuple aim. This is a beautiful model, right? So before we know that the triple aim was there, and then the quadruple aim, and then the quintuple aim. So what is quintuple aim? So quintuple aim is, one aim is to reduce cost of care. Another aim is to reduce the physician burnout. And then we need to improve the population health burden. And then we need to improve the patient experience. And eventually, we achieve health equity. So that is quintuple aim. It's like a temple, like 5 pillars, if you look at it, that you reduce the cost. And when triple aim was there, it was patient experience, reduce the cost, and population health burden. But they actually then thought that who are the healthcare providers? They're not thinking about the providers. And that's the time it came that, we need to reduce the population, we need to reduce the physician burnout. We need to help the physicians to provide better healthcare. And at last, the 5th aim came, the health equity. So that's the quintuple aim. And that's it for today. And if anyone has any question, I'd like to take. Any questions? Great. Either we do, we're still just finished our, yes, sir.
So a question for you. I think you brought up an interesting point about the value-based care. We spoke about all the 5 players in the ecosystem to have a value generation for them.
Right.
Now, do you believe it's, how do you believe it's possible that you can derive value for all the 5 players, whether it's a payer, pharma, provider, and the patient altogether? Because I think somewhere it's a dichotomy where you, like, if somebody, for example, if you pay some amount of money, maybe if the money is less, the payer loses or the provider loses. How do you balance that out? What was your approach on that?
Great questions. I really appreciate that. So we were actually talking about it a couple of days back in our university setting. So how can we add value? So if you think about it, that there is a fixed budget, right? So every patient, there is a budget allotted for that patient. Suppose you have, it's $10 per patient. So you have 10 patients, so total $100. Now think about it, that the payers, they're getting the money from the government. So $100 total budget, and if they spend $60 for these 10 patients, so they're saving $40, right? And in value-based care model, this savings is actually distributed. It's distributed among the providers, it's distributed among the pharmaceuticals, and everywhere. So now what's happening is volume-based. It's like whatever the service, the number of service they're getting, that's how they're getting the reimbursement. But in value-based care model, the more you save, the more you do the profit sharing. And that's how everyone in the value chain will be benefited. It's not only the providers, it's not only the patients. So patients are getting the quality of life. That's what matters to them. And in terms of reimbursement, everybody is actually doing the profit sharing, and that's how they are getting the value, if that answers your question. Sorry?
It answers to some extent in terms of this ethical standing, but still a European thought.
Yes,
It has to be
I know
implemented
that.
on the ground.
But in the US healthcare, that's how they're thinking about it. But in a universal healthcare model like in Europe, so I don't think that would be the case. Any other question? So I think that's it. Thank you so much. And I really appreciate that. And I really congratulate everyone for the work everybody is doing and trying to make a difference. And hopefully we'll actually achieve the Earth's furthest dream of better healthcare. Thank you.
Thank you so much, Tanwir.